APOSI peeps! Welcome back to our Wednesday Wellness webinar. So today, we will be discussing about something to do with our spinal column or our vertebrae. Let's welcome Nurse Claude to discuss this topic, herniated lumbar disc. Hi, Nurse Claude!
Thank you, Nurse Edlin. Good morning, everyone. I am Mary Claudine Casabuena, and our topic for today is herniated lumbar disc. For today's presentation, we're going to tackle the overview, the symptoms, the causes, treatment, and its prevention. Herniated disc is a most common disease that can lead from mild to severe pain on your lower back. We have 24 vertebrae in the spine. It is connected with several joints which allow us to bend, twist, and carry loads. The white one in here, it is a bone and it is called a vertebrae. The brown one is what we call an intervertebral disc. It is firm on the outside and it has a jelly-like structure inside. The red one in here, it is what we call a herniated disc. It is a condition where there is a bulging or protrusion of disc material of the lumbar spine, which may cause spinal nerve compression. Maybe you are wondering why. What are the symptoms? Here are the following symptoms of the herniated lumbar disc. First, we can feel a mild pain on the back and hip that gradually increases. It has also a generalized numbness and loss of strength over times. So, hindi siya nangyayari overnight lang or over a day. But, nangyayari ito because of matagal na siya, nagkakaroon tayo ng problema, and then hindi lang natin siya na-address yung problem. Instead, hinahayaan lang natin. So, because of that, it gradually increases yung pain na nararamdaman ng patient. So in some patients also, the pain may be chronic or severe. Kasi may mga patient na yung pain tolerance nila is mababa, yung iba naman is mataas. Then we also have a sciatica nerve pain. A sciatica, it is a pain that radiates along the path of the sciatic nerve that will start from the lower back, then bababa siya sa hips, down to the buttocks, and then sa legs na natin. We also feel a loss of bladder control and loss of coordination. Also, it has a heavy feeling of the limbs and trouble balancing. Maybe we are wondering what are the causes of herniated lumbar disc. First, we have age, because as we age, we loses water content. And aside from that, our disc degenerates also as we age. Our ligaments that hold in place begin to weaken. Because of that, single excessive strain or injury can cause a rupture into the disc because of degeneration that progresses already. We also have a vulnerable to disc problems. These are already patients who are diagnosed with herniated lumbar disc problem. What are the treatment? We have two kinds of treatment. First, we have the non-surgical treatment, and the other one is surgical treatment. We have an NSAIDs medication for a non-surgical treatment. NSAIDs stands for non-steroidal anti-inflammatory drug. When taken, this will relieve swelling and pain. Another one is we have a cold therapy. After 24 to 48 hours, it reduces swelling, muscle spasm, and the pain that the patient will feel also reduces. We also have a spinal injection. This uses an epidural steroid injection wherein it is injected into an infected area. And lastly, we have a physical therapy. In physical therapy, it is the doctor who will order a combination of treatment to lower the pain, and it will increase flexibility of the patient. So example of these are gentle massage, stretching, and pelvic traction. Now let's go to surgical treatment of the lumbar disc herniation. We have discectomy. For discectomy, it is a full removal of the part of the intervertebral disc. Because of this removal, it promotes relief of the nerve pressure and the leg pain as well. Another one is laminotomy. In laminotomy, it is only a removal of a bone part that covering the nerve. And lastly, we have a minimal invasive spine surgery. In this operation, it does not require a large incision. It just uses a small cuts and tiny instruments during the operation. What are the testings and diagnoses that we use for this? First, we have an X-ray. For X-ray, it will show a structure of vertebrae and outline of the joints. The CT scan or the computed tomography scan, this shows the shape and size of spinal canal, its content, and structures that surrounds it. We also have MRI or what we call a magnetic resonance imaging. This is a diagnostic test that shows the spinal cord, the nerve roots, and the surrounding areas. Through this MRI, madedetect if ang patient magkakaroon na ng enlargement, degeneration, or even tumor doon sa area. Then we also have electromyogram and nerve conduction studies. It is a test to measure the electric impulse along the nerve root, peripheral nerves, and the muscle tissue. All of this, how can we prevent it? It pays off to have a good posture. How to have a good posture? When we sit, we have to sit straight and don't slouch. Kasi pag nakaupo tayo ng straight, for example, our lower back looks like this, yung lumbar natin. So, dapat naka-arc siya, hindi siya dapat naka-press. Kasi when we flex, when we sit and when we flex, yung lower vertebrae natin, nagkakaroon siya ng more pressure. Nalalagyan siya ng more pressure. And because of that, yung lower disc natin, nagkakos siya to weaken. Another one is we don't have to smoke or we have to quit smoking because smoking can cause our bones to get brittle. It also good if we are eating healthy food choices. And exercise is very must for its prevention, and use of good body mechanics is also important. As shown in the picture, hindi natin kailangan mag-flex or mag-bend. Instead, when we pick up something lower than us or nasa floor, we have to spread our legs, then baba tayo ng konti, and we have to lift it up. That ends my presentation, and thank you for listening.
All right. Thank you so much for that, Nurse Claude. So I just want to add, if you want to know more about good body mechanics, you can search it through Google, and you can also look for any YouTube tutorial so that you will be able to know on how to carry a specific item or thing without destroying our body mechanics or our body posture. So for our next week's topic, that would be a 4-minute exercise wherein you can use at the office or at home or while doing work from home, and it will relieve us of any type of stress that we are experiencing. So thank you for stay tuning, guys. Have a great day and bye.